Global Health System Solutions (GHSS) has provided 18 laboratory professionals from 6 West Africa member states, including Liberia, Cape Verde, Sierra Leone, Togo, Benin, and Mali, with additional skills and knowledge that will help them better contribute to enabling the reference laboratories of their respective countries obtain the ISO 15189 accreditation. This was during the second training workshop on strengthening laboratory management towards accreditation SLMTA 2, which took place in Monrovia-Liberia from the 2nd to the 7th of October 2022 under the auspices of the Liberia Minister of Health.
You all must be very proud to be participants of this workshop, because this will make a difference. You all are the future of Africa. As we all stand, we don't want to be just waiting. You also can remember that during the beginning of the COVID epidemic, what was said, Africa must prepare. And look what happened. I think God in his wisdom, even though he knew where we were, he spared of the tragedy that could have occurred yet. But today we can stand up, all of us, and be proud that we all did well. We are all moving towards vaccination success.
The SLMTA 2 training, which was organized as a continuation of the SLMTA 1 training that took place in Benin last June 2022, is part of the Regional Integrated Surveillance and Laboratory Network RISLNET project for West Africa, funded by Africa's CDC and being implemented by Global Health System Solutions in collaboration with the West Africa Health Organization WAHO. Speaking during the SLMTA 2 training, the Africa CDC's RISLNET West Africa Project Coordinator underscored the importance of the RISLNET project to the Africa continent.
To build capacity of different public health specialists to make sure that we are ready for the next pandemic.
The SLMTA 2 training was therefore organized to further build the capacity of laboratory managers and technicians on laboratory quality management systems. For 5 days, a team of SLMTA master trainers and trainers from Global Health System Solutions took the 18 laboratory professionals from the reference laboratory of Cape Verde, Sierra Leone, Liberia, Togo, Benin, and Mali through experiential sessions on work area management, inventory management, procurement management, and equipment maintenance, being modules 2, 3, 4, and 5 of the SLMTA toolkit.
These modules are going to help in the procurement, because if you don't have reagents, if you don't have equipment that are functional, even with the good personnel, you will be unable to release the results. That's why these elements are key in the management of the lab.
The laboratory professionals were also taken to the Redemption Hospital near Town, Liberia, for a practical session on laboratory audit in some laboratories of the hospital. The laboratory professionals were implored to use the skills and knowledge gained during the 5 days of continuous training and capacity building to improve on the quality management systems of their respective reference laboratories and lead them to accreditation.
You will continue to work very hard as you return to your different countries to implement the skills and knowledge that you have learned here in the different domains from the modules that were selected on the SLMTA 2 training, to make sure that you improve on your laboratories and lead them towards accreditation.
Meanwhile, the laboratory managers, technicians, and biologists were unanimous that the second training workshop on strengthening laboratory management towards accreditation was timely.
We now know that the quality management system is not only for an individual, per se, the quality officer of the laboratory, but instead it involves the collective action of everyone involved in the laboratory.
Nous connaissons tous la valeur de ce concept qualité sur la qualité des résultats que nous donnons à nos patients, qui vont amener à une meilleure prise en charge de ces patients.
Está neste momento a financiar, em parceria com o GHSS e o Instituto Passador Cabo, 2 projetos em Cabo Verde. Uma é a acreditação do laboratório de virologia do
consistent in following procedures, not doing it my own way, and also enabling the lab as well as the lab manager, all the staffs to go according to the procedure.
The laboratory professionals also have a clear idea of how they will begin making use of the lessons learned to improve on the quality management systems of their respective laboratories.
We have had broad knowledge around quality management system. I think we can use these skills and manage our colleagues in such a way that we will put heads together, join our efforts so as to reach accreditation.
Nous espérons qu'à l'évaluation qui aura lieu au mois de janvier prochainement, que nous puissions vraiment avoir beaucoup d'étoiles, en tout cas au moins de nous espérons.
Meanwhile, the African CDC's RISLNET West Africa Project Coordinator commended Global Health System Solutions on its strides in the implementation of the RISLNET project.
Let me appreciate the collaboration that is there between Africa CDC and GHS, and hoping that this small collaboration will continue to be there. I think this is the 4th year that we are partnering with them to implement this project in Central and Western Africa.
As the implementation of the RISLNET West Africa project continues, Global Health Systems Solutions is determined to leverage its experience of leading 5 laboratories in the Central Africa region to accreditation to train, mentor and prepare the national public health reference laboratories of Mali, Benin, Sierra Leone, Liberia, Togo and Cape Verde for ISO 15189 accreditation.